Hello everyone, this is Taiwo Okubanjo. The topic of my presentation is ADHD with comorbid conduct disorder. Let me introduce you to ADHD and conduct disorder. According to the National Institute of Mental Health, attention deficit hyperactive disorder, ADHD, is a disorder marked by an ongoing pattern of inattention and hyperactivity, impulsivity that interferes with functioning or development. Also, the APA, American Psychological Association, mentioned that people who have ADHD have problems getting organized, inattentive, making realistic plans, and thinking before acting. They are the ones you see. They're always fidgety, tend to make a lot of noise, and unable to cope with changing situations. Conduct disorder, on the other hand, the significance of this is that many studies have reported that most ADHD children developed comorbidity with conduct disorder during childhood, and the symptoms may progress severely during adolescence. Let's look into a case study of a 12-year-old boy named Kylie. Kylie was diagnosed ADHD at early age for being unusually aggressive and bullying other children. His mom verbalized that Kylie doesn't know the rules. He began to see a psychiatrist in fourth grade for weekly psychotherapy and medications. He was being given quetiapine and dexmethylphenidate. A year prior to Kylie's admission to the unit, he was caught stealing, mugging, and had been suspended for multiple fights in school. According to Kylie's mom, Kylie is unremorseful and he externalizes his feelings of others. He has poor academic performance. When interviewed on the psychiatric unit, Kylie was casually groomed and he appeared a stated age of 12. He looked kind of fidgety and made sporadic eye contact with the interviewer. Kylie said he is mad and he insisted he would rather be in jail than on a psychiatric unit. He denied feeling depressed, suicidal, or homicidal ideation. Assessment of Kylie shows a known history of ADHD diagnosis. Kylie is inattentive, disruptive, impulsive, and fidgety. Is shown history of aggressive behavior. He bullies other children and he takes their things. Kylie has engaged in multiple fights with classmates. Is caught stealing from school lockers. He consistently unremorseful, externalizing of blames, and uninterested in the feeling of others. Kylie is very disorganized and he has shown poor academic performance. He's shown no regard for rules and no concern for punishment. Kylie is most likely suffering from ADHD with comorbid conduct disorder. Apart from the known ADHD diagnosis that manifested from Kylie's hyperactivity and impulsivity, a constant finding is that children with ADHD are likely to have persistent conduct problems that extend into adulthood. When you look into the DSM criteria for conduct disorder, Kylie pretty much meets more than three of the criteria. He's shown aggression to people. He shows destruction of property. Is deceitful and also shows series of theft. He shows serious violation of rules. is also a disturbance in behavior causing clinical significant impairment in social and academic life. The treatment in Kylie's situation requires an early multimodal intervention involving both pharmacological and non-pharmacological therapy. Ritalin is the best non-stimulant and most widely used ADHD medications. Non-stimulants such as risperidone and atorvastatin have been shown to be effective. Non-pharmacological management has been the mainstay of treatment in managing the conduct disorder. Behavioral parent training is a useful tool that is administered by a licensed therapist, BPT as they call it. The main objective is to teach parents the skills of developing and implementing a contingency management plan. Cognitive behavioral therapy is an intervention that has been intended to address the social cognition deficit and to improve problem-solving skills in the social context in children and adolescents with conduct disorder. The contingency management programs are known to improve positive parental skills, slowly shape the child's behavior, setting goals and achieving goals, and discouraging undesired behavior. In summary, ADHD is a common condition in children and adolescents. The presence of comorbid behavioral disorder will have significant impact on the kid's functioning. An early intervention employing a combination of psychosocial and pharmacological therapy will have a positive impact in the child's functioning. Thanks.